Assalamu alaikum guys. This is station or case on the sexual assault, the teaching sexual assault, teaching your junior for sexual assault. So how we do that teaching? We follow all the template of the teaching, right? Hello, I'm Dr. Shabnam, the ST5, and you are? Nice to meet you, Jimmy. I heard that you joined us recently. How is going so far? I understand you are the one who wanted to know about sexual assault. Can you tell me why you are interested in the sexual assault? Jimmy, have you ever seen that or examined before or read it before? What are your expectations from today's sessions? Okay, so Jimmy, what we are doing today, I'll tell you the definition, how we take the history, how we do the forensic examination, and management. And see the diagram made by you and giving you the feedback. In the end, I'll give you a link of talk article on the sexual assault. How it sounds to you? Okay, Jimmy. So see, the definition of the sexual assault is defined as the sexual assaults occur when a person A intentionally touches a person B. The touching is sexual. The person B does not consent and the person A does not reasonably believes the person B consents. So this is the sexual assault. Assault by penetration occurs when a person A penetrates the vagina or anus of person B with any part of their body other than a penis or any object. The penetration is sexual. Person B does not consider it and a person A does not reasonably believes the B consent. Rape is defined as the penetration of the mouth, vagina, or anus of the person B with the penis of person A. The person B does not consent and person A does not necessarily believes the person B. Am I clear to you, Jimmy? Mm-hmm. Good, you are the good learner. Sexual assault is common with 1 in 5 women aged 16 to 59 years. It covers the offenses from indecent exposure to rape. Many women complaining of few or no injuries. Only 1/4 of the women presented with having a genital injuries. So any woman presented with assault, if stable, take history first. If not stable, do emergency resuscitation. If deep injuries, sutures is first. Once the patient is stable, then ask history about the incident. Am I clear to you? Good. So in the history, you have to ask about when it was happened, with known person or unknown, with one person or group of the person. Were you intoxicated? Any use of the object, or if it's used, whether anal, vaginal, or oral. Whether she washed or changed clothes, whether swabs were taken or not, when was her last menstrual period, any other unprotected sex in same cycle, because there is 5% risk of the pregnancy. So it's very important to ask about the last menstrual period and use of the emergency contraception, right? Okay, go for the history continue. You have to ask about the medical comorbidities, about STIs, contraception wishes, and the drug allergy because you are giving her the medications. Also assess the risk of domestic violence, then inform the consultant. Am I clear to you? Could you repeat it for me? What the history points you have to ask from your patient? Mm-hmm. Good, very good. So, Jimmy, you have to assess the GLEC competence. If the girl is less than 16 years of age or below 18 years, if they have any learning difficulties, you have to assess whether she is mentally competent or not. If she wants forensic examination, inform the police and SOC may offer a forensic medical examination with collection of DNA and other evidences without the police being involved. So giving the woman opportunity to consider her options and report the assault at a later date. Am I clear to you, Jimmy? Okay, good. Women should be advised not to wash or wipe herself if she is considering a forensic medical examination. She should also not eat, drink, or pass urine prior to early evidence being collected. The early evidence kit that is available in the emergency department contains mouth rinse and urine pot. Minor injuries that do not require a suturing should not be cleaned initially because sample can be taken from these sites for DNA evidences. Each injury should be described in the clinical notes, type of the injury, whether laceration, bruise, hematoma, the shape of the injury, depth, color, and tenderness. If possible, use a body diagram and a tape measure to measure the size of the injury and its distance from the fixed anatomical landmark. For example, a 1 into 3 centimeter purple bruise 5 centimeter above the left knee joint. It's possible to photograph the injuries, but written consent will be necessary for this. Digital camera can be used and genital injuries can be photos documented using a colposcope. Am I clear to you? How we manage such women? First, we have to manage her pregnancy prevention because there is a vaginal rape carries a 5% risk of the pregnancy. So that's why the lost menstrual period is very important, right? The copper IUCD is the most effective form of emergency contraception and can be inserted within 5 days after the first in unprotected sexual intercourse in a cycle or within 5 days of the earliest estimated date of ovulation, whichever is later. Ulipristal acetate emergency contraception has been demonstrated to be more effective than the levonorgestrel up to 120 hours after unprotected sexual intercourse. Offer UPT after 3 weeks of assault. Am I clear to you? Could you repeat it for me when you offer the UPT? After 3 weeks. That's very good. Very good. You are the good learner. Screening for sexually transmitted infection, the swabs for STIs now. You have to take the swabs for STIs now and repeat 2 to 3 weeks after the assault because of the incubation time of pathogen. Blood test now and repeated 3 months should be offered to screen for hepatitis B, syphilis, and HIVs. HIV post-exposure prophylaxis, that's called the PAPC, should be discussed with every woman. Unprotected anal intercourse carries the highest risk of HIV. So, prophylaxis against bacterial sexually transmitted infection is rarely offered but can be considered in those whose risk of infection is high and who are unlikely to attend for follow up. Women should be offered hepatitis B screening and vaccination within 6 weeks of the assault. Am I clear to you? In journal, the swabs can be taken up to 7 days after vaginal penetration, 3 days after anal penetration, and 2 days after oral penetration. A toxicology screen will be sent from blood within 3 days of the assault and from urine within 14 days of the assault if a drug facilitated sexual assault is suspected. Could you repeat it for me? When we take the swabs, very good, very good. The rape victims are more likely to develop the post-traumatic stress disorder than victims of any other crime. So involve the psychologist, support groups, and counselor. Am I clear to you? Mm-hmm. Very good. So how the session went? Give me the feedback. You are the good learner too, right? So I'm giving you the link of the talk article. You have to go through that, and if you have any question, read it. If you have any question, come back. I would be happy to conduct a session again. Am I? Thank you. Thank you so much, guys.